About a quarter of Wisconsinites have received at least one dose of a COVID-19 vaccine.
Vaccines have not been approved yet for children under the age of 16, but that's about 20% of the state's population.
So when can we expect vaccines to be approved for them? UW Health's Chief Quality Officer, Dr. Jeff Pothof, joins us as he does every Tuesday. Doctor, good to see you again.
Hi, Dr. Pothof. Good to see you.
Good to see you guys, too.
How important is it to get young people vaccinated under the age of 16?
You know, it really is an important part of our herd immunity strategy. If we look at young people, they do make up, 25 to 30% of the population. So to reach that 70 to 80% of the population vaccinated, we do need to have a fair number of children or young adults vaccinated.
We mentioned earlier in the show about the Moderna adolescent vaccine trial on this very issue. But what happens if we don't reach herd immunity between young people and people choosing not to get the vaccine? Is that a potentially put us at risk of not reaching it?
Potentially it does. If we can't vaccinate any children, that would make that job much more difficult. If that is the eventuality, it does mean that COVID would be hard to extinguish. It would still be in our communities. Those people who are unvaccinated would continue to pass it to other unvaccinated individuals, and they could have illness and hospitalizations from that. But those who are vaccinated would be protected. So it's not as dire as it was when we were in the middle of the pandemic and no one was vaccinated, but at the same time isn't a best case scenario to have that disease still present in our communities.
There were some reports out of Europe that the AstraZeneca vaccine was causing blood clots in some people, and apparently the health officials in Europe said that such a small number is nothing to be worried about.
Yeah, I think we've seen this with a lot of the different vaccines is there is a hair trigger to push the pause button whenever anything pops up that seems like it might be related to an adverse event for a vaccine. And I think this is important because people want to have confidence that these vaccines are safe. In the case of the AstraZeneca vaccine and these blood clots, it does appear that the rate of blood clots in people who got the AstraZeneca vaccine is no different than the rate of blood clots in people who don't get the AstraZeneca vaccine. So with that logic, it would be concluded that AstraZeneca vaccine does not increase your risk of getting a blood clot compared to the general population, which is good news.
Well, the Oxford AstraZeneca vaccine is not approved yet in the United States, but many people remember you were one of the first people, maybe the first person at UW Hospital to participate in the vaccine trial. Do you know yet whether you received the actual vaccine or the placebo?
Yeah, so back in December, when the Pfizer vaccine was first announced as available, I was placed in the 1A category, not because I talked to you guys on TV, but because I'm a med flight physician, I work in the ED, I have a high risk of getting exposed to COVID. And as part of that process, I was unblinded from the AstraZeneca trial, and I did receive the AstraZeneca vaccine. Unfortunately, at that point, we didn't really know anything about the efficacy of the AstraZeneca vaccine, so I had elected to get the Pfizer vaccine when it was offered to me, just to make sure that I was protected and I wasn't necessarily putting my family at risk.
Interesting.
A whole new group of people are eligible to get the vaccine now next Monday, but that doesn't mean you get the shot right away. There's going to be quite a backlog.
Yeah, as this 1C group comes up, it's going to be a very large number of people. We do know that vaccines are coming. We're getting them in greater numbers. But with such a large group of people now eligible, vaccinators still working on the current group of people that are eligible, I wouldn't necessarily think that that means by next Friday, 2 million more people in Wisconsin will be vaccinated. It will take some time, but nonetheless, it is encouraging to see more and more people eligible for these vaccines.
How would you describe where we are right now in the pandemic, especially with spring break coming up and after a long winter, people are anxious to travel? Where are we and what is your guidance about that?
Yeah, I really think it's a tale of two cities. So there is tremendous good news. Case numbers are down. Hospitalizations are down. Vaccines are available. They're available in greater quantities. 10-11% of the U.S. population is now vaccinated. But we have these variants. We're starting to see states stall in their cases. Some are trickling upwards a little bit. We're seeing things fall apart a little bit in the European Union with Italy now reinstating lockdowns. And I think this is an important message because with all the good news, it's easy to let our guard down, but the virus is still there. And if we're too complacent, it will come back. We could have another wave. So we're close. We're close to the end, but we just have to hold the line for a few more months as more people get vaccinated.
We're not there yet. Doctor, good to see you again. We'll talk to you next week.
Talk to you later.
Thank you, Dr. Pothof. Good to see you.